Good morning, everyone, or good afternoon, good evening, wherever you are in the world. I wanted to introduce myself. My name is Dr. Saimun Singla, and I am a board-certified pediatric rheumatologist in Houston, Texas. I also have fellowship training in something called integrative medicine, which I will talk about today. And just to give you a little bit of background on me, so I was practicing as a rheumatologist, attending rheumatologist, meaning you've gone through all your training. And then a year or so after out of training, I was diagnosed with rheumatoid arthritis myself. So when I all of a sudden became the patient, instead of the physician treating people with arthritis, it becomes a very eye-opening journey. You learn a lot of lessons, and you learn where there's gaps in our knowledge in the traditional world. So that kind of helped me or inspired me to pursue extra training in integrative medicine. And today I'm going to explain to you kind of what it is, as well as how I use it to manage my own arthritis. So my goals and objectives are basically for you to define the term integrative medicine, understand what it is as well as what it isn't, understand the term integrative rheumatology, and how I use integrative medicine or integrative rheumatology to treat my own RA. So number one, what is integrative medicine? So integrative medicine incorporates your conventional, traditional medications, imaging, labs, procedures, along with complementary therapies that are all based in evidence. Okay, so they have enough reasonable amount of evidence to basically support its use along with your traditional therapies. Another way of thinking about it is integrative medicine equals conventional medicine plus evidence-based complementary therapies. So for example, in the management of migraines, I have a picture here on the right. You want to take your medications, but you also want to be mindful about a bunch of other things that really hone down various lifestyle factors. So what you're eating, caffeine, alcohol, what kind of things you're doing to help with the stress component if you have migraine. So deep breathing, exercise, keeping a journal, acupuncture, reduced screen time. So you want to be mindful and take kind of a bird's eye view of your entire life rather than focusing on just one part of it, which is what medication can I take to get rid of symptom X, Y, and Z. So is it the same thing as complementary medicine? No, they're not the same terms, because complementary medicine is going to be referring to treatments that are not considered standard of care when they're used as standalone therapies or by themselves. So for example, if you're using acupuncture to treat moderate to severe rheumatoid arthritis, that is not complementary medicine. That's actually alternative medicine. You're going into that realm. Same thing with hypnosis or, therapy with just supplements alone, or massage therapy and just meditation alone. So complementary, it's just going to complement or make your basis of therapy, which is going to be your traditional medications and evaluation, and you're kind of making it even better by adding these various factors to it. Now, does integrative medicine equal alternative or functional medicine? No, a lot of times, even within the medical community, these terms are used interchangeably, and they really shouldn't. So alternative medicine, remember, is when you're ditching conventional therapies for something that's not standard of care. So you're using, again, like I said, supplements to manage your arthritis, rather if your doctor has recommended other medications, but you're choosing not to use those and doing just supplements alone. That's alternative. Functional is basically focusing on, it's similar to integrative medicine because it takes a holistic approach to the patient, but it's very biochemical focused. So it focuses on finding a root cause to a person's illness. They use a lot of labs, including stool and blood work. They look at your metabolics, food sensitivities, intolerances, digestion, gut microbiome, those things like that. Integrative medicine is going to use your standard medical therapy, as I mentioned, with complementary therapies with the goal of treating not just the body, but as well as the mind and spirit. And most of the complementary therapies used are going to be tailored for specific illnesses that are supported by the NIH, or the National Institute of Health. And they have a whole arm on research on complementary and integrative health. This is kind of from their website, the NIH website, showing you a picture of what integrative medicine is. And basically over here, you have your drugs, then you have your botanical drugs, you have your dietary supplements like calcium, vitamin D, you have the nutritional component to it, the different types of food you can be eating, you have the psychological component to it, right? Your mindfulness practice, breathing techniques, things like that. And then you have your physical component. You also have acupuncture over here, surgery, various devices that you could use. So the picture in the management of someone with a chronic illness like rheumatoid arthritis is so complex because it's not just your physical manifestations, right, at the microscopic level. It's just at the bigger picture is kind of what you want to target in addition to the little stuff like the inflammation. So putting everything together is how you're treating the whole person, not just focusing on one box. So then what's integrative rheumatology? So it's a niche of rheumatology that's going to blend your traditional allopathic Western practices with various complementary therapies. So for example, when you're treating someone with arthritis, you're looking to see how severe their disease is, if they need medications, if they need labs, if they need imaging, if they need joint injections or any other procedures. But in addition to that, you're going to be directing patients on anti-inflammatory diet, various supplements if they need it, massage, acupuncture, mindfulness training. But you're not going to ask a family or a patient to do this, to do every single one of these factors. It's what's realistic for them. You're going to lay it out and say, hey, this is what kind of the evidence is, and this is what we should be doing, and this is what is going to help, but you be realistic. I deal with children day in and day out, and having them stick to an anti-inflammatory diet from childhood onwards is really a hard struggle. So you have to strike a balance between what works and what doesn't. So in just last fall, in November, the American College of Rheumatology came out with guidelines for the use of integrative techniques such as exercise, rehab, diet, massage therapy, chiropractic therapy. And they basically put together a group of people in a room and with various expertise. So a PT, OT, a nutritionist, a rheumatologist that's trained in integrative medicine as well. And they dug up the research on these various topics. And anything that's in green is basically where they had agreement in recommending it. So consistent exercise, aerobic exercise, aquatic exercise, it's a green light. Physical therapy, splinting, adaptive devices, also green light. When you're talking about diet, the Mediterranean diet has the most amount of evidence in managing chronic illnesses like rheumatoid arthritis, which is why it's a green. Any other diet, they're not going to formally recommend because it may be great, but it doesn't have enough evidence to support its use. And so they recommended against it, as well as dietary supplements. Now, if they talked about supplements as monotherapy for a condition or in addition to, I'm not exactly sure about the details because the full paper hasn't come out yet, but overall it was a no-go for use of dietary supplements. Other things that they didn't recommend were electrotherapy as well as chiropractic therapy. Now, so what I created in my own practice called Room to Grow here in Houston is something called the integrative approach and a pyramid. So this pyramid is, think of it almost like a Jenga tower where your elements of health are made up of each block of the Jenga tower. And if you're missing pieces of it, your Jenga tower might crumble. And at the base, very foundational piece is going to be your conventional evaluation and management. You're going to build on top of it with things like your nutrition, sleep, movement, mind-body exercises, manual medicine such as physical therapy, occupational therapy, massage, osteopathic manipulative therapy, acupuncture, supplements, as well as towards the top, we get to social and family support and resilience. Now, social and family support are incredibly important in managing any chronic condition because you are looking at others who have the similar conditions and saying, what do you do to make your arthritis better? How do you make your migraines go away? It really sucks to have this, and so when you are able to have that camaraderie with other families, you don't feel so alone in managing this. And so various examples are going to be Cheryl's Room to Thrive, as well as the Arthritis Foundation has a lot of areas for support to connect with other people. And the most important thing to get out of these groups is also resiliency, because anytime you manage a chronic condition, you're going to have good days, you're going to have bad days. You cannot let those bad days pull you down and because it doesn't reflect your overall life. It doesn't reflect an adequate picture of what it means to live with the disease, because you're also going to have good days as well when you did something right and you feel good. And so resiliency is going to come with, yeah, I had this bad day, but you know what? I'm going to get back up and, you know, get on the train, because I know sleeping makes me feel better. I know doing getting a massage makes me feel better. So that resiliency is really key in not letting yourself get down. But first, before I even kind of go into any of the various components of the integrative approach, the first thing I always recommend to my patients is something called symptom tracking. So I actually made a symptom tracker, simple, on Excel. And basically, each number is going to represent a day of the month. And over here in the very first column, you have the symptom that you're going to want to track. And so on a level of 1 to 4, you're going to grade, okay, on the first of the month, how bad is my knee pain? How bad is my morning stiffness? How bad is my headache? Whatever it is that you want to track. And once you start plotting it over the month, I always like to connect the dots and basically see, okay, what were the overall patterns? On the days that I had a bad day, what did I eat? Who was I around? What was I doing? In the case of children that I work with, did they have a final exam coming up? Did they have a bully? What were they anxious about? Or when the numbers were on the lower end, kind of what made those lower? That's kind of what you want to figure out, what works for you and what doesn't work for you. And so when you look at a global view of the month, I think it's a more accurate depiction of kind of your triggers and alleviators, rather than just focusing on 1 or 2 days. And so when I'm talking about the integrative approach, I am going to put a green star next to the ones I'm going to talk about, which is going to be the conventional evaluation, nutrition, sleep, movement, and mind-body exercises. So in my own management of arthritis, I have to be on 2 different medications, a biologic and a DMARD. My biologic is the biweekly Singla, so I take that twice a month, as well as weekly subcutaneous methotrexate. Do I love being on these medications? No, nobody likes being on medications where you're at increased risk for infections, and nobody likes that. And these pokes hurt every single week, but in my head, what I express gratitude to these medications, because they've kept me healthy. They have made me do what I'm able to do, which is come into work every day and teach other kids how to be the same way, right? How to have that same mindset. So instead of having a negative attitude towards these medications, I try to flip the script and talk to it in a positive way, as silly as that sounds. But that way I don't hold resentment every day, every week when I have to inject myself. And supportive things I do during flares. And remember, flares now I can predict with the symptom tracker. For me, I figured out that lack of sleep or international travel, things like that, sitting on an airplane for long periods of time, they triggered my arthritis flare. So I knew right off the bat that if I was going to be traveling or going through jet lag or have a night shift or be on call, I better have these things ready. So that was Tylenol, Motrin, paraffin dips, warm packs, hot water bottles, take an Epsom, salt bath, get extra sleep or rest, however that is, massage, compression gloves. These all help me kind of reduce the stiffness and the pain and those down days. The next thing I'm going to touch on is nutrition. Nutrition is a huge topic. So why do we even care about nutrition in managing something like rheumatoid arthritis? This is great evidence as to why we should be worried. It's one of the various factors. So in 2019, the American Heart Association actually came out with guidelines on how we prevent primary things like your first stroke or your heart attack. And part of that guideline, they had a little table right here that shows things that increase your risk of even having heart attack and cardiovascular disease. That's what CVD stands for. Chronic inflammatory conditions like RA and psoriasis and lupus and HIV, those things already increase your set point to have these type of bad outcomes like your stroke and heart attack. So if you're already living up here, one way to control that and bring that risk factor down is going to be through nutrition. The other reason is because nutrition is equivalent, one of the many important factors that adds to your gut microbiome. And gut microbiome, I think of as your garden of life, right? They're bacteria, funguses, viruses, protozoa that live anywhere from your nose all the way down to your large intestine. And so you want those gut bacteria to be working in your favor, because if they don't work in your favor, they can cause a lot of disruption and dysbiosis, leading to various forms of illness. And inflammation is just one of those tiny things. And Another point specifically in the management of rheumatoid arthritis is that these gut microbiome basically produce something called short chain fatty acids, SCFAs. And what those guys do is have an anti-inflammatory effect because they block the production of certain proteins that create havoc or inflammation. So that right off the bat, that is your anti-inflammatory effect of having a good microbiome. A good microbiome is going to come from your diet. So eating high fiber foods, right? Complex carbohydrates, because these are the things that we as humans can't break down. The gut microbiome breaks it down for us, the fiber. And when they break down that fiber, they produce these short chain fatty acids, which gives us the beneficial effect. So we need them. We need them not only for blocking inflammation, we need them to help us produce norepinephrine, epinephrine, dopamine, various nervous system hormones that help us regulate our mood and behavior as well. And they also produce great vitamins like vitamin K, B12, B3, B6. This is just a small number of good things it does for us. So then it begs the question, okay, well, what am I supposed to eat? Am I supposed to cut out gluten? Am I supposed to eat only vegetables and fruits for the rest of my life? And the answer is simply there's no one size fits all. If there was, there wouldn't be so many studies on diet. There wouldn't be so many recommendations on diet. There wouldn't be so many books on diet fixing various illnesses. Everyone's story is different. So take it with a grain of salt. In general, what I always recommend based on studies in nutrition is that you want to have a diet that's very heavy in plant-based foods. So your fruits, vegetables, nuts, things like that. And that translates to the Mediterranean diet. And the Mediterranean diet has the most amount of research in the world of heart attacks and strokes. And the two largest ones that actually made doctors kind of think about nutrition as more of medicine rather than just food were the Lionheart study and the Predimed study. And in the Lionheart study, they looked at patients who had heart attacks and strokes. And then if you put these patients on a Mediterranean diet, did it decrease their risk of a second heart attack or second stroke? And you bet it did, by 50 to 70%. That's huge. These are big numbers that you can't always get with even medications. In the Predimed study, if you've never had a stroke or heart attack, if you ate a Mediterranean diet, did it decrease your risk of heart disease? It did, by 30% compared to people who weren't on a strict Mediterranean diet. So this all points to the fact that food is important. It's going to add fuel to the fire that is your immune system. And so if you can at least control that aspect of the inflammation, it's not just going to help your arthritis, it's going to help your future risk of things like heart disease and strokes. Now, excuse me, one of the things is called the anti-inflammatory diet you may have read about. And the anti-inflammatory diet is basically a combination of the Mediterranean diet as well as the Okinawan diet that comes from Japan. So it's very heavy in fruits and vegetables, whole grain fibers, as well as fish, seafood, teas, green teas, especially herbs, things like that. Limited in the poultry component, in the red meat component, because these all come with a lot of saturated fats. So it's not that you can eat it, you just want to be mindful of how much of it you're eating. The common theme is basically cut down the processed and sugary foods. So that's where the key is. Increase your intake of fruits and vegetables and decrease the sugary and processed foods. That's the biggest takeaway from it. Now, moving on to sleep. So a lot of times I think people equivalent sleep to an indulgence, like, oh, they're getting 8 hours of sleep. They're clearly not, stressed enough or working hard enough. And that just simply isn't true. Okay. There's been tons of studies linking sleep to inflammation. And that's what this graph is. It's called a forest plot. And it basically looks at various studies that were done in the 2000s, looking at the link between sleep and inflammation. And at the very bottom, you'll see this red diamond. And it's to the right of this vertical line, meaning that if you combine all the results of these studies, there is, in fact, a link between sleep and elevated markers of inflammation. In this case, it was a marker called TNF-alpha. So we know that stress, lack of sleep causes elevated inflammatory markers. Not only that, it's going to create chronic stress. A lack of sleep is going to cause elevated glucose, which increases your risk for type 2 diabetes. It also suppresses your immune system, and which means you're going to have an overall risk of infections, elevated blood pressure, heart disease, and strokes. The other thing is that there's a bidirectional relationship between sleep and pain. People who have pain don't sleep well. People who don't sleep well are at higher risk for pain syndromes like chronic pain and fibromyalgia. So it's a vicious cycle, and you definitely want to tackle the sleep component. So what are some things that I do to optimize my sleep? Unless I'm having a flare, I try not to nap during the day. It's really, it's easy with being busy during the day and having kids and stuff. But if you get a chance to nap and you're trying to optimize your sleep, fight through it. Don't nap. It kind of offsets the circadian rhythms. Second thing is no screens at least 1 hour before bed. I know this is a very tough one for me because at the end of the day, I am watching shows with my husband. That's our, time together, talking and watching, and then scrolling right before bed on Instagram, Facebook, whatever it is. I try to cut that off 1 hour before bed. Now, be realistic with yourself. If you can't do it 1 hour before bed, try 20 minutes before bed. Try, 30 minutes before bed, whatever you can do. But the point of it is to decrease the amount of exposure to screen time or light, because that blocks the production of melatonin, and melatonin is what you need to fall asleep. I also like to spray a little bit of eucalyptus from Bath & Body Works on the pillows. I do breath work. I listen to guided imagery and as well as journaling if I have time. And for the breath work, I do something called the 4-7-8 breath, where I take a deep breath in for 4 seconds through my mouth, hold it for 7, and then breathe out, blowing the air out through my mouth for 8 seconds. And that kind of helps reset the nervous system from a flight or fight stance to more of a rest and relaxed mode. I also try to keep a dark environment. We don't have the TV on in the room at night. It's cooler as well. I have a sound machine on in the background. And I try to increase physical activity where I can during the day. So if I can take the stairs, I'll do that instead of the elevators. The next thing is movement, which means physical exercise, stretching, those type of things. You got to learn what works best for you. I used to be a marathon runner. I did a lot of high intensity running, and in the last few years, it just doesn't work for me anymore. It makes me hurt, and it makes my knees hurt. So I've ditched that, and I kind of had to do a rest in peace to that part of my life. I try to walk when I can. I'll do a light jog. But for me, I've learned that yoga is what works for me, because the stretching component, the flexibility component, the mindfulness component all hit the areas that I need for me in this season of my life. Not only that, we all know physical activity helps with multiple things, including the cardiovascular health, the mental health, the anxiety, stress management, but also bone density. That's important for patients like us. We need to have that buildup of calcium in our bones. The last part that I wanted to talk about was the mind-body component. This is huge, 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 huge. So when I'm talking about mind-body component, I'm talking about things that fight stress and cause us to be anxious and depressed and nervous and feel that doom and gloom of having a chronic illness. So take a step back for a second and realize that not all inflammation is bad. So stress does cause inflammation, but sometimes we need inflammation to be able to fight off infections and cuts. It's the cornerstone of healing. But when it goes unchecked, because of things like long-term stress, because of your job, people around you, having to deal with a chronic illness, this causes the adrenal glands, which are little, they're almost like little beans that sit on top of the kidney, which look like kidney beans, and they release steroid or cortisol, which is nothing other than a steroid. And a steroid, as we all know, is a potent anti-inflammatory, right? That's what our rheumatologist gives to us when we have a flare. And so when you have chronic levels of stress, chronic levels of cortisol, your body is now flipped to more of a anti-inflammatory mode rather than a pro-inflammatory mode. Well, guess what? When you're ill, you need to go into a pro-inflammatory mode, which is why people who are stressed tend to have more coughs, colds, flus. They're more prone to it because their body is sitting in a can't fight mode because they're in an anti-inflammatory status. And so one thing to note is that we can't change the world around us. That is wishful thinking. But really the primary focus should be on what can we change inside of us and how do we increase the recovery time or resiliency from those hits of stress. And the key to that is going to be in mind-body therapies. And I teach this starting children that are 4 or 5 years old, from breathing techniques that they can control how they respond to the world, but they have to practice it every day. So it's the same conversation with adults. And these mind-body therapies are basically practices that are designed to enhance the mind's positive impact on the body. And some examples include meditation, the 4-7-8 breath that I mentioned, guided imagery, where you kind of listen to different stories. The Insight Timer, which is a free app, has hundreds of stories to listen to, kind of help you do breathing exercises or meditation. They guide you through it. Yoga, journaling, drawing, painting, clinical hypnosis. I mean, the list goes on and on. There's progressive muscle relaxation, Tai Chi, so many things you can do to help with the stress component. You got to find what works for you. Meditation's not for everybody. You have to build up to that. The goal is just to give yourself a pocket of time in the day to decompress. And so by doing that, you're reducing the stress response, you're activating the vagus nerve, which is basically the arm of your nervous system that's the brake and helps you with the rest and relaxation mode. It activates various hormones that you need to help with regular moods and behavior. It also, most importantly, changes the brainwave activity in the frontal lobe and the limbic system, meaning that when you're in a stressful situation, instead of being reactive and using that primitive part of your brain, you are aware of the situation, you are aware of what you can control and can't control, and you move on with it. You don't let it take over your body. Now, the trick is in order to get to that state, we have to practice these mind-body therapies consistently. Nothing good that happens to us happens overnight, right? Nothing this long-term is going to happen overnight. You have to practice it. So if it's going to be worth it, guess what? That means you're probably going to have to put in work. And this is one of those things that I cannot give you a prescription for. I cannot do a procedure on you. This is you having to stand up for you and practice this. So this is kind of what works for me because it helps me get better sleep, which also helps me have decreased flares. So that is kind of integrative medicine in a 20-minute whirlwind nutshell. If you have any questions, please feel free to email me at info@roomtogrowtx.com. My website is roomtogrowtx.com. I'm also on Instagram and Facebook. So I'll be around for the live session to answer any of your questions. All right, thank you.